Meantime, two local doctors, Dan Erickson and Artin Masihi, have gained national attention, as we've been reporting, for their candid comments about reopening the economy and lifting stay-at-home orders here in California. Our live stream of their press conference earlier this month has garnered nearly 9 million views. But experts around the country have strongly criticized their claims. 17's Karen Hua consulted some of them, historians, statisticians, and infectious disease doctors, to fact-check the doctors' statements.
Doctors Erickson and Masihi own a chain of accelerated urgent cares, and this one right here is the largest coronavirus testing site in Kern County. This is where they've been pulling most of their data for the past 2 months, and that's partly why two national physician organizations recently banded together to condemn their ideas.
There's folks that are at home, they don't have a job, they've lost their source of income, there's increase in alcoholism, folks are depressed, suicides happening, people are struggling, and so we felt that we had to be an advocate for them.
On Fox News this week, Doctors Erickson and Masihi say they are voices for the voiceless. During their press conference last Wednesday,
this has caused some severe disruption for Accelerated, as we have people coming in 7 in the morning till midnight, and at the same time our volumes have dropped significantly.
In response, the American College of Emergency Physicians and the American Academy of Emergency Medicine released a joint statement, reading in part, quote, "As owners of local urgent care clinics, it appears these two individuals are releasing biased, non-peer-reviewed data to advance their personal financial interests without regard for the public's health." The Medical Association's statement also calls the doctors' ideas, quote, "inconsistent with current science in epidemiology regarding COVID-19.
We've never seen where we quarantine the healthy. We've never, ever responded like this in the history of the country.
But we have, according to historian Ken Hooper.
There is a definite parallel between now and the Spanish flu in 1918. Rosedale School District, and then the city of Bakersfield and the Kern High School District closed. Philadelphia, they got hit really hard. They more or less locked down the city. They said you couldn't go outside.
There have also been statistical disputes.
What is materializing in the state of California is 12% positives. Well, if we have 39.5 million people. If we just take a basic calculation and extrapolate that out, that equates to about 4.7 million cases throughout the state of California.
While Dr. Erickson said 12% of Californians are positive, actually it's 12% of Californians tested who are positive. So statistician Dr. Craig Hayward says you can't apply that 12% to the whole population like the doctors did.
There are problems with how you get to that 12%. So if you're arriving at it by testing people who are coming in for testing because they're concerned that they may have coronavirus, what you've done is you've used a biased sample, because that's not the whole population.
Therefore, the death rate the doctors calculated is off, since they used a biased sample number.
0.03 chance of dying from COVID in the state of California.
The true fatality rate is likely considerably higher than that.
Ultimately, the two national physician organizations conclude, quote, ACEP and AAEM strongly advise against using any statements of Doctors Erickson and Masihi as basis for policy and decision-making. Their viral ideas have sparked a national discussion about how to interpret science and numbers when making the decision to reopen. In Southwest Bakersfield, Karen Hua, 17 News.
And we just received a response from Accelerated Urgent Care. Dr. Erickson says, quoting here, "We are not interested in bickering with medical institutions. Accelerated is focused on solutions and caring for our patients with the highest level of compassion and integrity. Accelerated has been a leader in giving testing results to Kern County to help treat and manage COVID-19 illness." He also says more about the company's work in Kern County. We posted the full response on our website at kget.com. You can read it there.